Hi guys, welcome to another video and welcome to my channel if you are a new subscriber on here. And if you are viewing my videos for the first time, please do hit the subscribe button and be part of the STI channel. Disclaimer, you guys, I am a mess today, okay? Number one, I am a mess because of the sound and the noise that is happening on my background. There is like some drilling going on outside my consulting room right now, but I have to film this video and it really needs to go up, so excuse the noise. And the other issue is that I forgot my camera at home. Can you guys believe it? I left my camera at home. I took my camera's charger, I took an adapter, I took everything that I knew I was gonna need for filming this video, and I left the actual camera bag. How? I don't know. When did I get to see that? When I was looking for the camera in my bag. But yeah, it is what it is. So I'm using my phone to film this video. Like, I even feel like I'm rambling. Anyways, today we are doing a video mainly because I know that there are a lot of videos around this topic that always have a disclaimer at the beginning of the video that I am not a healthcare practitioner, I am not a doctor, I am not a nurse, I'm not working in the hospital, but I'm here to give you my own experiences. So now I am giving you guys a disclaimer that I am a healthcare worker, I am a professional nurse, I'm a registered nurse, I'm qualified to do this, and I am here to dish out this information. Today's video, it is on sexual transmitted infections. I'm obviously going to touch bits and parts of some of the diseases that women get to experience in terms of sexual reproduction. I'm not sure if I want to make this video a sexual transmitted infections in women or sexual transmitted infections in general, and like encompass both males and females. But if I decide to make it females only, then it means a part 2 of this video will be males sexual transmitted infections. So yeah, this intro is already super duper long. Let's just get into it. Focus. All right, so this is the manual that I will be using for today's video, because in nursing we always have to refer, we always have to back up what we are saying with proven research. We can't just say things, do things without references. So even when you are prescribing for a patient, you have to refer to a guideline, you have to refer to a book where you get your prescription, your management, your diagnosis, and your investigations and all that. So I will be using this book today. This is the Guideline for Sexual Transmitted Infections Management, and it was published in 2015. It is adopted from the Standard Treatment Guidelines and Essential Drug List Primary Healthcare. So this is what we use in the primary healthcare setting to treat sexually transmitted infections. Firstly, we need to understand that sexual transmitted infections can be preventable. Early detection and early treatment of sexual transmitted infections prevent one from transmitting the condition to their sexual partner or to their unborn children. So there are other sexual transmitted infections that can be transmitted from the pregnant woman to the unborn baby, such as syphilis. So that is the background of sexual transmitted infections. These are sexually transmitted diseases that can be prevented. Some of them can be cured. Most of them can be cured. So let us go ahead and speak about the first and the most common one that a lot of women get to experience. That is the vaginal discharge syndrome. What is a vaginal discharge syndrome? A vaginal discharge syndrome is when a woman gets to experience or to see an abnormal vaginal discharge. When we are talking about abnormal vaginal discharge, we are talking about the color and the odor. So an abnormal discharge will move from being clear, from being white, to being cream white, to being brownish, to being greenish. Green means you've enjoyed, baby girl. You've been enjoying things, and this sexual transmitted infection has been there for some time. So it moves from being clear or white to being cream white, to being yellowish, to being brown and to being greenish. Okay, that's the color of an abnormal discharge. So the normal discharge, it's white or it's clear in color. And the other thing that you can tell by your discharge is abnormal is the odor of the discharge. So obviously we do not smell like strawberries down there. Okay, if your vagina smells like a strawberry, then I don't know what you're doing with your vagina, but I don't think it's healthy. So when we are talking about a bad odor, we mean that the normal smell of a vagina, I think every woman knows the normal smell of a vagina, but strawberries and bananas are not the normal smell of a vagina. But if there is an odor that comes out of your vagina that even you yourself can smell it, and when you smell it you don't feel comfortable with other people smelling it, and the odor becomes so strong that when you stand up you can feel it, when you are walking you can feel it, when you are sitting for a long time you can feel it. That is a sign of sexual transmitted infections. So these are the questions that your healthcare provider will be asking you to assess if you are having any sexual transmitted infections or if you are having a vaginal discharge syndrome. Firstly, they're going to ask you if your partner, if you are a lady, obviously like ladies are the ones that gets to have vaginal discharge syndrome. So they're going to ask you if your partner has been treated for MAS, MAS being the male urethral syndrome. Obviously, if your partner has had MAS, it means he might have like infected you with the sexual transmitted infection. So they're going to ask you if your partner has had MAS. Then if your partner has had MAS, they're going to confirm your abnormal discharge. Obviously they have to like see it. Nurses have to check if your discharge is really abnormal, and they also have to ask if you are having any lower abdominal pains. And if you are having lower abdominal pains, then they're not going to treat it just as a vaginal discharge syndrome. They're going to like move to the lower abdominal pains flip chart. We're just gonna get into it right now, because once a patient now has abdominal pains, it means it might not just be sexually transmitted infections. Okay, but if you are having an abnormal discharge which is smelly, it has malodor, which has a different color from being clear or from being white, it is yellowish, it is creamish, it is brownish, greenish, or yeah, all those nasty colors. If that is what you are experiencing, then you are having what we call vaginal discharge syndrome, and your nurse will treat you with antibiotics for 7 days. In that 7 days, you will be expected to use a condom if you are going to be sexually active. But I normally advise my patients to abstain in that 7 days. And obviously, guys, it is, I want to say compulsory, but I want you also to know that you have an option to decline. But doing an HIV test, if you can get vaginal discharge syndrome, it simply means you can also get HIV, because HIV is also a sexually transmitted infection. So yeah, that is what's up with vaginal discharge. Now I want us to move to lower abdominal pains and actually just go through it and understand the difference between other reproductive related diseases, because lower abdominal pains don't always mean that the woman has sexual transmitted infections. There are a lot of things that can cause lower abdominal pains on women, and also that lower abdominal pains might be accompanied by abnormal vaginal discharge. That doesn't mean the woman now has what we call a vaginal discharge syndrome. But how do we eradicate all these other sexual reproductive illnesses from sexual transmitted infections? Let's move to lower abdominal pain. So on lower abdominal pains, women can come into the consulting room complaining with lower abdominal pains with or without an abnormal vaginal discharge, right? That doesn't automatically mean I will know that this woman has sexual transmitted infections. Anything that has lower abdominal pains, it means I have to eradicate or eliminate other possible reproductive diseases such as pregnancy, missed periods. And missed periods don't always mean that the patient has the patient is pregnant. Sometimes missed periods means that the patient has what we call hormonal imbalance. Hormonal imbalance can cause a woman to have amenorrhea sometimes. And some of the things that I would have to like eradicate during lower abdominal pains is recent deliveries. Top is termination of pregnancy or miscarriages. I would have to like eliminate things such as abdominal guarding. I would also eliminate things such as tenderness, abnormal vaginal bleeding. Abnormal vaginal bleeding can be a sign of so many things. It can be a sign of fibroids. It can be a sign of CA, cervical cancer. It can be a sign of so many things. So there is what we call abnormal vaginal bleeding. Abnormal vaginal bleeding can be your prolonged bleeding, your spotting bleeding, especially when you are not on any family planning method, but you find yourself having just an abnormal vaginal bleeding. So those are the things that one needs to like eradicate before they assume a woman with lower abdominal pains has sexual transmitted infection. The other thing that one would have to eliminate is abdominal masses. So you have to palpate your woman. Like I said, but some women might have fibroids. Through palpation you can feel fibroids in a woman. I think that you need to like check out in terms of women with lower abdominal pains is fever, like elevated temperature that is above 38 degrees Celsius, because fever is also a sign of infection. So yeah, those are the things that as a nurse you need to like exclude before you can assume by a woman with lower abdominal pains has sexual transmitted infections. So once you've excluded those, if a woman has any of the things that I've just mentioned right now, that woman needs to be sent to the hospital for further investigations where they're going to do sonar and all those things that you might not be able to do in the clinic. So if you go to the clinic and experiencing any of the things that I just mentioned right now, just know that there will be possibilities of you being referred to the hospital for further investigations, because in some clinics they don't do sonars and all that. But if a woman doesn't have any of those things, then you have to also do urinalysis. Urinalysis is us examining your urine through a urine dipstick in the clinic, and that investigation takes 1 minute. We will be examining your urine to exclude urinary tract infection, because with women urinary tract infection can also be confused with sexually transmitted infections. Once they exclude UTI and your urinalysis results come back as normal as possible, then that's when we can say a woman has a sexually transmitted infection which presents itself with lower abdominal pains with or without the vaginal discharge. You remember I said at the beginning, on the vaginal discharge syndrome, you have to ask the woman if they're having any lower abdominal pains. So a woman with an abnormal vaginal discharge will be treated differently in terms of management with the woman that has a lower abdominal pain STI. Okay, the management is not the same. So that's why when a woman has abnormal vaginal discharge, you have to ask if they are having lower abdominal pains. If they do, then you flip to the lower abdominal pains chart, but if they don't, you treat them according to the vaginal discharge syndrome. Once you've excluded the conditions that can relate to the women's health, the ones that I just mentioned, and also you've excluded your UTI, you can now conclude and say the woman has sexual transmitted infections that presents itself as lower abdominal pains with or without discharge, and treat it according to that management. So yeah, man, I don't know, I think this video is long enough, and that means I will be doing a part 2 of this video where I will be dealing with the signs and symptoms and the types of sexual transmitted infections that males get to experience. Thank you so much, you guys, for watching, and if you are having any questions, comments, go ahead and drop them down below and I will get to you guys as soon as I can. And if you feel you need a little bit of privacy, you can find me on my social media platforms inboxes and hit me up with a message there. I will definitely respond. So if you are new, please do not forget to subscribe and join the family. I love you guys so very much. I'll see you all on my next video. Bye guys. Oh, by the way, you guys, these are not the only sexually transmitted infections that a woman can experience. We have sexual transmitted infections such as syphilis, gonorrhea, I think, what is it? Is it clammy something? I'm going to write it here, chlamydia or something like that, but I'm going to I think I'm going to write it somewhere here. So we've got a lot of types of sexually transmitted infections, but the ones that I just shared with you guys are the most common sexually transmitted infections that women get to experience, and they are the treatable ones. So yeah, so if you want me to actually do the complicated sexual transmitted infections diseases such as syphilis, if you want me to dive deeply into those, then let me know. Those are the ones that I left out on this video. Bye guys.